Okay, so we will talk more about the baroreceptors when we get to blood pressure. So just kind of hold on to that thought and remember that they detect stretch. Okay, we'll talk about them more. Okay, now there are chemoreceptors. Okay, so chemoreceptors are going to detect chemicals. The primary chemical that they're detecting is hydrogen ion. Okay, so that's the most important one. However, if you look at it, pH, carbon dioxide, and oxygen are all linked together. So we'll talk about that too. Okay, so they're detecting pH, carbon dioxide, and oxygen levels. The chemoreceptors are found in the aorta, in the carotid arteries, and in the medulla oblongata. Most of the time, what they are doing is they're controlling respiration, so how fast you're breathing, but they could influence your heart rate. So if you have high carbon dioxide, okay, which is called hypercapnia, that raises the hydrogen levels, and when we raise the hydrogen levels, that makes us acidic or takes us into acidosis. Hypercapnia and acidosis stimulate the cardiac center, so it increases the heart rate because we want to get rid of the CO2, and we want to get rid of the hydrogen ions, and we want to increase the oxygen. Okay, so these are just vocabulary words for you in case you didn't know those. And we'll talk about pH in more chapters further on. Okay, now, remember CO equals HR times SV. Okay, so SV is stroke volume. Okay, so we have to discuss what kind of factors influence stroke volume. So we're going to talk about preload, contractility, and afterload. Okay, so preload is how much tension is in the ventricle muscle before it contracts. So preload is actually going to change contraction strength. Okay, so increased preload causes an increase in contraction strength. Okay, so the tighter the tension is in the vessel, the more it's going to contract. So kind of think about a balloon, and if you blow it up really high, really big, and you let it go, there's lots of pressure in there, and it's just going to fly away. Okay, so that's kind of the same thing that we're talking about. So I have written down tighter, stronger the balloon is, the more forceful the air is that comes out of it. So it's the greater the stretch, the greater the force. Okay, now, don't worry about this. I have this crossed out in my notes, so cross that out. Okay, and then the Frank-Starling law. The Frank-Starling law states that ventricles eject as much blood as they receive. So the more they're stretched, okay, so the increased preload, the harder they're going to contract. Okay, so it states that the stroke volume is indirectly related to the end diastolic volume. Okay, and I'm not too hung up on that. There's some other more important things that we need to know. Okay, now, contractility is contraction force. Okay, now, things that are going to change contractility are called inotropic agents. Okay, so they change the strength of the contraction. Okay, so ino is muscle. So I have tension caused by factors that adjust the myocyte's responsiveness to stimulation. So different things change how hard it is to stimulate the cardiac muscle cells. Okay, so factors that are going to increase contractility are called positive inotropic reagents. Okay, so they're going to increase it. They're going to make it contract harder. Okay, so that means the blood is going to get pushed out harder. Okay, so those things are hypercalcemia. Okay, so that would be an increase in calcium ions. Catecholamines, okay, so neurotransmitters, glucagon, okay, and digitalis. So digitalis is a heart drug. Okay, now digitalis, it increases the strength of the contraction, but it decreases heart rate. So you can't just be giving it out willy-nilly. Okay, so it reduces the heart rate, but it makes your heart beat stronger. Okay, now factors that decrease contractility, they're called negative inotropic agents. Okay, so hyperkalemia, hypocalcemia, hypoxia, and hypercapnia. Okay, so hyperkalemia means excess potassium. Calcemia is decreased calcium. Hypoxia would be decreased oxygen, and hypercapnia is increased CO2. Okay. Okay, now afterload. Afterload is the pressure in the arteries that are just beyond the semilunar valves. Okay, this afterload, what it does is it opposes the valves opening, so it kind of keeps the valves closed. So if you increase the afterload, you're going to decrease the stroke volume. So what it's going to do is it's going to slow down or impede the circulation of the blood. So that is an increase in afterload. So that's not good, right? We want the blood to be able to get into those vessels and get to the lungs or get to the body. So sometimes what happens, so continuous increase in afterload could be due to lung disease, arteriosclerosis, scarring, like maybe some sort of disease that affects the vessels. Maybe there's vessel weakness. Okay, so what happens is in order for the blood to get out of the heart muscle has to beat harder. So you get hypertrophy of the myocardium. So hypertrophy of the myocardium means you have an enlarged heart. So your heart is beating harder to maintain cardiac output. Okay, so eventually what happens is then after the heart gets enlarged too bad, then it can cause it to weaken and fail. Okay, so it's all about the health of the arteries. Okay, now, exercise and cardiac output. So the whole idea is that if you're moving and you're exercising, it's going to increase your cardiac output and it's going to make you healthier. Okay, so effective proprioceptors. So proprioceptors are going to get your heart rate up when they detect that you're moving. You're going to get more blood back to your heart. Cardiac output's going to go up. Your heart muscle is going to become stronger. And this is a picture that just shows coronary arteriosclerosis. So this is hardening of the arteries. So normally here's an artery. Okay, so this is the lumen. So the lumen is the hole inside of there. And then this is the wall of the artery. Okay, so normally we have a nice clear hole with lots of room for the blood to flow. So if someone has plaque, so they have some buildup in their arteries, what happens is the lumen, the hole narrows. Okay, so it's harder for the blood to get through, so the heart has to work harder to get it through. So there we go.